welcome to the Westin MCAT podcast with your host, Ahmed and
Eric Olson.
All right. Welcome back, everyone, to another episode of the Westin MCAT podcast with Ahmed and Eric. Today, we're going to be going a little bit off script, not focusing so much on the MCAT, but more so what comes after the MCAT and after the application process, which is medical school, and what that experience is like, how it differs from undergrad, and what sorts of skills do you want to try to develop between now and when you matriculate that will ultimately serve you well. As per usual, though, before we get started, Eric, how's the Durham residency?
Durham residency is great. Can't complain, and we were talking before about kind of some of the things we want to talk about. And part of it is, this idea of coming to medical school and like having that as motivation of like getting to the next step and getting to something that you want to be doing. And it's funny, like medical school is awesome. And you learn so much, but over the course of the 4 years, then when you get towards the end, you're kind of like, okay, I'm ready to do the next thing,
Yeah.
And, so it's good, it's good to be in the next thing that you're finally wanting to doing. I'm just starting a month of dermatopathology, which,
okay,
we may touch briefly on this during our episode, but pathology or histology being looking at samples, biopsies, cells under the microscope, and you do a little bit of it in med school, but it's almost exclusively kind of in your first year, maybe some in your second year. And it's really not that much. So kind of a new world. Like I'm pretty comfortable in the clinic doing the basic things, but now I'm jumping into, looking at the biopsy specimens, and it's like it's starting over again. So it's kind of, I've been looking forward to getting into that, and it's something that's kind of mysterious to the rest of medicine and medical professionals. It's like, what are we really looking at here? It's been fun to like put on a different hat and kind of start to learn some new things and kind of round yourself out as a clinician, because we do all these biopsies in clinic, and then to be able to put it together with what you're seeing under the microscope and what that means for treatment options and kind of prognosis of disease course and things like that. It's been interesting. I'm only a couple days in, so we'll have to touch base later in the month, and I'll let you know if I've learned anything.
Fair enough,
Ahmed, this is more, I think this episode will be interesting to hear your perspective as kind of a new medical student. I guess you've been, how long have you been in school now? A month or two at this point?
Yeah, 6 weeks.
And, I guess, has anything surprised you? Like what has stood out to you in these first 6 weeks? Maybe something you didn't know. I don't know. I feel like you probably came into it better prepared than most. Like you knew what you were up against, but what has been kind of different from your expectations?
Yeah, that's a great question. I think one, I have more time than I thought I would have, which is great. Like I've been like, for context, like I have Wednesdays off. Monday, Tuesday, like Monday's the main like didactic lecture kind of day, and then in the afternoon we have like a case study that we do in a group, sort of independently. Thursday afternoon we meet with a doctor at the hospital to go through the case. So one thing that's actually given me more time in the week is we've learned to be more efficient as a group with that case study. Like at first we would meet for like 2.5 hours and like vet through everything, but then we had this brilliant idea that everybody just looks at the case ahead of time. And, if anybody, disagrees with any of the answers, we kind of type up, then we'll chat. But anyway, it ended up saving me a lot of time. Tuesday's an anatomy day. What that entails kind of differs from week to week, but usually it's just a 3-hour lab. And then, occasionally they'll have some sort of like longitudinal curriculum lecture in the afternoon, but not all the time. Wednesdays are off. Thursday is usually a professionalism ethics type of thing in the morning. For example, tomorrow we've got like an intro to shadowing presentation, so it's nice where like you can just show up, but like you don't have to take notes or anything like that. And so all this to kind of say, like, I've learned like which days of the week require me to be sharp and which days of the week don't require me to be sharp. Like Thursdays, I'll be there, but like I won't always be there. Wednesdays, obviously, I'm off. And so like learning what I can put on those days, and off the record, learning which things I need to go to, which things I don't need to go to, has
This is
helped
this is
me.
going on the internet, Ahmed. You realize
It's
people can listen to this.
I go to the things that I have to go to.
Yeah, yeah. And
But
that's how you should do it, right? Like you have to be
yeah,
discretionary as you move forward and learn
100%.
what's helpful for me, what's not helpful, what do I have to go to, what can I go to? And if it's, optional, is that going to be valuable for me? Sometimes they are, and sometimes they're not as much. Kind
Now,
of depending on your interests and things, right?
I will preface or I will, add an important, disclaimer here that anything that I don't go to is because it's recorded and I watch the recording later.
Yeah.
But if it's a non testable topic, you can put it on 1.5 or 2 times speed and turn it into a podcast almost. Like you got it in
Mhm.
while you're folding your laundry or you're, doing whatever. Um, but even like, for example, we have for this first block that we're in, we have exams every other Monday at 8 a.m. And then we have didactic lecture 9 to 12. Kudos to the folks that like do the pre-week material and sit down and attend that 9 to 12 lecture, but I'm not one of those people. So like that's like an example of something where like I just know like myself, like after I take an exam in the morning, I want to go home and either sleep or go to the gym and just like wake up. But like
Yeah.
I'm not gonna sit down and focus for 3 hours after taking an hour exam. I just know that about myself. And so,
And they record those lectures then?
yep. Yeah,
Yeah.
yeah. So I just watch them on my own time on like a Wednesday that I have off, and then it ends up working out well. But yeah, I think that's been the main thing I've learned is like how much time I have, where I can free up time, and like when I can sort of fit certain things into my schedule. Like, when am I working? When am I working out? When am I studying? When am I going to class? So that's been big for me. And I think anytime you start a new program or a new course, you're kind of feeling out the instructors a little bit as well.
Mm.
Like,
Sure.
how thorough are their materials, for example? Like, how much do I need to know outside of what they give me on slides? Right. So learning that has been helpful as well. Fortunately, the answer for me is not much.
Yeah.
And you also kind of feel out, okay, effort in, result out. Like, what does that relationship look like? We've had 2 exams up until now. Fortunately, passed both. First one, I mentioned their Monday exams. The first one, I like spent the entire Sunday before just like watching football. I think it was like week 2 of the NFL season, or maybe might have been week 1. I think it was actually week 1. And I did not study a ton past, but like not with necessarily as much buffer room as I would have wanted. Second one, you kind of reorganize, your schedule a little bit and how you want to study and, had a lot more buffer room kind of thing. So, I think that first month for me was really just kind of getting my feet wet and then sort of learning, okay, like what are the sorts of, strategies and skills that I want to have going forward that will hopefully at least allow me to maintain a similar sort of balance as things get a little bit busier.
Yeah.
Um, but yeah, I think, if I was to give anybody advice about going into medical school, like don't have preconceived notions. Like don't just assume, you're gonna have no time because then you're gonna think you have no time. Like I remember our very first day of class was an embryology lecture. And it like for anyone who hasn't taken embryology, it's a real wake up call. And,
Yeah, it's a good way to scare the new class, really.
but like it is and it isn't. Like if you just because it's a lot of new words, but if you go home, don't panic and you just try to just like piece things together, especially like, oh, okay. Like and embryo is one of those things where there's like lots of good YouTube videos where you can visualize things, right? But like there were people in my class that went home and studied for like hours of like on the Monday on the first day of class. And like I think it just kind of like it's an extension of maybe going into med school saying, okay, like it's going to be hard. I need to study like a lot. And then you sort of just turn it into a self-fulfilling prophecy. But I think, those are the two big things that I learned is one, like don't have preconceived notions. Like just because somebody says something is going to be hard or somebody says something is going to be easy does not necessarily mean that's actually the case. And then number two, just making the most of the downtime. I think like you have the capacity to do a lot of things outside of med school, at least pre-clerkship. And so capitalizing on that has been really great.
Yeah, it's interesting. I think like you said, kind of the notion that we have is that we're going to go to medical school and it's going to be really hard because
Yeah.
that's kind of what's presented to us, and it's difficult. Um, but and I'll be interested to hear your experience, thus far and moving forward. I found that medical school was not so different in terms of its rigor from my undergraduate degree. And maybe that was because I worked too hard as an undergrad. But I think,
Possibly.
we all work hard as undergrads, right? Like
Yeah.
you're preparing for something. And so you put in a certain amount of effort and you really learn things. And the stakes are a little bit different in medical school, right? Because the things you learn,
Yeah.
maybe some more than others, but have bearing on your ability to, clinically care for patients in the hospital and elsewhere. And so it's like it has some gravity now, you know?
Yeah. Yeah. Yeah.
Um, but at the same time, you've been working hard and you know how to study and you've been working on that. And so as you kind of feel out the new scheduling and kind of what strategies will work and what you need to pay the most attention to and things like that, I think the absolute rigor that you put into your studies, for me at least, didn't change all too much. Now there's a
Yeah.
difference, and I want to talk kind of ultra structurally for a minute about what medical school looks like because, and I've mentioned this before, I'm sure, but I came in with like minimal understanding of what was going to happen to me. um, the first couple of years, and I will caveat this as well by saying that pretty much everything we're going to say is program dependent. And so we'll talk
Yeah.
about some general patterns and some things that you can expect. But ultimately, if you go to a really small school in the Southwest, it might be different from if you go to, an ivory tower, big institution in the Northeast. There are just differences. Schools are run differently, and there are big patterns that most follow. But this is not a guarantee that this will be your experience. Um, the first couple of years in most schools are kind of didactic in nature, right? And
Yeah.
like Ahmed is saying, you have certain days where you'll have lectures, and my experience was similar. As far as like the recorded lectures go,
Yeah.
um, I was at first like going to all my lectures, and I soon kind of dropped that off. And then during my first year was like the 20 early 2020 was when COVID started, and so like they stopped having anything in person, and it was all virtual. And so I was watching everything at 1.5 to 2x speed, depending on what we were doing.
Yeah.
But those first 2 years, you have different classes, and everyone's taking the same classes, right? Like you're in this cohort of first year medical students, and you're not necessarily getting electives, but everyone is taking. There's a day where you do pharmacology, and there's a day where you do histology, and there's a day where you do anatomy, and there's a day where you do physiology. Probably multiple days where you're doing physiology and embryology and all the ologies.
Yeah.
But what's kind of nice is at least my experience was that for a certain period of time in November, we talked about the heart and kind of the cardiopulmonary system. And it was like all of these different classes in different areas, but they were focused on cardiopulmonary physiology, right? We did
Hmm.
cardiac anatomy and we would do cardiac histology and stuff like that. And so they kind of all run in parallel. And so you're learning kind of by system or, whatever format your school will take. But you have a number of different classes. They're all kind of focused in similar areas and everyone's doing it together. My experience was similar to yours, Ahmed, in that like our exams were not as frequent, but we had exams every like 6 to 10 weeks, I think it was,
Oh, okay. Yeah.
on the block. And, that counts for a pretty significant portion of your grade. In
Yeah.
my first couple of years, we would have small group sessions where we talked about ethics and things like that. Very, very similar. We talked about, like how to do a physical exam, how to interview a patient, things that are
Yeah.
like,
Yeah.
integral but basic kind of components of how to take care of patients because it's not something you've done before.
Right.
So those first couple of years will be, not dissimilar from what you're used to. And so you go to class and then you go home and study. And one of the nice things that you kind of have touched on, Ahmed, is that you have more time to do other things. It's not because the classes are easier, but at least my experience was that I didn't feel so pulled by all the things that you're expected to do as a pre-medical student. Like you had to do the volunteering and you had to do the research and you had to do this and you had to do leadership and you had to do that. Um, I think there's room for those things in medical school. Certainly, it doesn't hurt to do those things, but I think you have a little bit more leeway in saying this is something that's really valuable to me. Like I actually really like research and I want to spend time doing it. And so you can focus your energies on research instead of splitting any extra time you have between I'll do a little bit of research and a little bit of volunteering. And
Right.
there are lots of people who try to do it all. But I just what I want to emphasize is that I think you have some independence as a medical student.
Definitely.
You're not as confined to like these are the requirements that you have to meet to
Yeah.
apply to residency. Because to apply to residency, basically you just have to have completed, your medical schooling and pass the boards and everything like that. Like you don't have to do all these checking of boxes that I think we expect of ourselves when we're applying to medical school. So
Yeah.
that's nice. Um, I don't know what before I kind of get into the later years of school, what has that looked like for you? Are you like getting into things? Are you kind of taking it slow and seeing what you're going to be interested in, or
Yeah.
you taking some time to yourself? I know you're still working. I mean, I didn't work when I was in medical school, so that's a big kind of bucket of time that is being taken away from you. Like how are you spending your extra energy?
Yeah. So, for context, we don't actually like shadowing opportunities, for example, haven't opened for us, and they open, I believe, next week. So
Mm.
I'll probably throw in, I think we have to complete like 36 hours of shadowing in our first year, which is really like not a lot. Like
Yeah,
that's
very doable.
like 6 days, right? So if I do a day a week until Christmas, like I'm kind of done. Um, but yeah, the main three things that I've really been doing have been, school, work, and then, sports. Like I continue to play squash. Like I'm playing on the team here at my university, and we have our first like conference matchup on Saturday. So a couple days from now, playing some tournaments outside of that, which has been great. But yeah, slowly dipping into we'll call them co-curricular, extracurricular components of medical school. When shadowing opens, going to start, pursuing those opportunities. As far as research goes, I'm not the person that's just like, you know, hunting down just any and all research opportunities. I'm a little bit more selective because I know from my own experience, it's a research project that I'm not passionate about. It's gonna be a real dread and drain on my schedule. So I'm looking into, things that I would, I ask myself, would I wake up at 8 a.m. to do this? And not necessarily because the research, timeline starts at 8 a.m., but more so because like it's just a measure of like, am I passionate about this kind of thing? But yeah, those are the two areas that I'm going to slowly start to sprinkle in the research and the shadowing, probably more shadowing than the research at this stage,
Huh.
just because the way I look at it is like I want to shadow to get an idea of like what specialties I'm
Yeah.
definitely interested in. And then from there, you can sort of tailor your research to those fields and start to present a really compelling, residency application and such. Um, and also, like, I think an easy way to get your foot in the door with some research projects is to just have connections with, physicians and faculty and such. And so, the shadowing is a nice sort of stress-free, no commitment way to do that. Like you
Yeah.
shadow a neurologist, for example, you don't have to go back. Like you can leave the hospital that day and say, all right, yeah, never doing that again, and that's okay. You start a research project though, kind of locked in. Like it's quite unprofessional to join, and not I don't want to say unprofessional, but like it's definitely a worse look to join a
Yeah.
research project and say, oh yeah, by the way, not for me. You know,
Well, and the nice thing about the shadowing is like that's then a portal of entry if you want to get into research that you had someone that you met and worked with for 6 hours and you can say, hey, actually, I'm really interested in this field. And, what do you
right?
have going on? Or is there anyone in your department who, does a lot of research and would you introduce me? And it's nice, being a medical student, you have access to the resources and I
Yeah,
mean, you're kind of low on the totem pole as far as the hospital goes, but you have some status in the medical system that you don't have as a pre-medical student, right? Like I remember
Yeah.
as a pre-med, calling around to find people to shadow with, and some said yes and some said no. As a medical student, you pretty much just reach out. I mean, they're not obligated to say yes, but you
Yeah.
have
Yeah.
like
Yeah.
some say, it's like, hey, I'm part of your institution. Part of your job description is to teach medical students. I'm here and I'm interested in shadowing, and I wouldn't put it with something like that, but
Yeah.
people are very accommodating. Teaching is part of their job, and they do teach medical students all the time, mostly when they're kind of on
Definitely.
clinical rotations, but they're used to having you around. And it's nice, you're like, hey, I'm interested in your field. Can I get on some research? And people are very accommodating. If they have opportunities, at least, my experience was that they're generally very willing to share those opportunities. I think
Yeah.
you're approaching it really well, Ahmed. It's so tempting to like, I'm sure there's some handful of people in your class who are like diving into a million things, and you see those people and you're like, should I be doing that? Like, I don't want to get left behind. And it's really tempting to like overdo it early
Yeah.
on. But I really think you're doing yourself a service by kind of taking stock of things before you dive in, and moving
Yeah.
kind of slowly so that you can not overextend yourself, because I think that's easy to do.
Appreciate it. Yeah. I think you can definitely tell who's more panicked than others. We'll put it that way. And like you just overhear conversations sometimes, and you're just like,
This is not the energy I want.
no. So
Yeah.
yeah, that's a very respectful way to put it. I think like look, like everybody's got different perceptions and perspectives, right? Like, you know, yeah, and I think it really just goes to show like how much we are a byproduct of like the people around us kind of thing. Like, for me, like I had a friend of mine who went to the same university, also played on the squash team, and now he's I think PGY 2 at UCSF for neurology. So he's doing great,
Yeah.
right? And like, that was a resource that I was able to tap into. And he basically just said, like, your first 2 years actually are not that bad. Like, you have opportunity to explore what you want to explore. I
Yeah.
heard that and I knew, okay, cool. Like, obviously, like, I need to confirm that for myself. But, like, there's other people who have been told, like, yeah, medical school is like harder than your undergrad. Like, I've heard some people, which I think is ludicrous, but a lot of people are saying your first year is your hardest. I was like, I don't know what world you
I don't know
know
about that.
like your first year of clerkship maybe, but not your first year of medical school. But anyway, like I think it's just, it's kind of apparent that some people have been given bad advice.
Sure.
And granted, like there's always this process of, like I said, just sort of vetting advice for yourself. Like you can have it in the back of your mind, but until you confirm it, it is just advice. It's nothing more than that. But I agree with you, Eric, in the sense that like, I have a routine that I'm comfortable with, that I enjoy, and I'm just adding layers onto it as I go. And, I think that's a really cool part about medical school. Like you mentioned earlier, is like, you're not really checking boxes. Like, yes, you want to show interest in, certain specialties, especially competitive ones, if those are the ones you want to apply for. But like within like, nobody's going to do anything in their first month of medical school that's going to separate them for a competitive residency. You know what I mean? Like, I
Yeah,
think,
absolutely.
it, you know, they're the folks that are, you know, it is very much like a marathon, right? Like you'll have a couple of people just like sprint to the front of the pack at the beginning, and then you get about halfway through and they start lagging a little bit behind, right? They went too fast, too quick. And that's what I don't want. Like just avoiding burnout, just making every day as enjoyable as possible. And for me, like I know what things get me excited.
Yeah.
And so just like making sure that I really tailor my education to those things. And then, at the same time, I think it's important to diversify, right? Like one of the things I'm really trying to pride myself on is being open-minded. Like, I'm sure you can relate to this. Your first month in medical school, everyone and their mothers are asking you, do you know what you want to specialize in? Do you know what you want to do for residency? Like, it's just like, I just got
I
here.
just got here. Yeah.
I'm trying to figure out where MSB 3153 is. Like,
Yeah.
let's relax on this whole residency talk. But like, you know, you talk to some people and they're like, yeah, I know I want to do X, I want to do Y. I've always been of the mindset that like, yes, I have interests, but I'm trying to keep an open mind and I'm not going to rule anything out until I shadow it. Is
Yeah.
kind of my mindset. Like I need to like and shadow it more than once because like maybe you just have a bad experience with, not even just the physician, but like maybe you just have a really tough, series of cases that day, right? And it's not representative of a typical day in that specialty. But um yeah, I think I'm definitely not, the person at the front of the pack, like just sort of, barraging into a number of different, we'll call them experiences. I think for me, like just kind of feeling things out and then being selective with what I want to get into. Just because I know there's other things outside of research, outside of shadowing, outside of school that I would still want to be able to tend to. And I think, that's the nice thing about med school is you have a little bit more flexibility to tailor your education to what you want. Like
Yeah.
obviously the curriculum is set in stone. That's probably the major difference from med school to undergrad. Like you have no say in what courses you take, but like you chose to go to medical school, so you kind of signed up for them by default. But um in undergrad, right? Like you have some ability to customize, but it's within this sort of pre-med bubble. You know what I mean? Like you have certain boxes that you need to check to different extents, right? You don't have to check all of them by any means, but I think that's the nice thing about medical school is like you don't want to do oncology research. You don't have to. You don't want to do research at all. You don't have to, but like you may limit your residency applications a little bit. But like the point being, like you get to choose what you want to learn more about, what you want to delve into, and I think it's really great. And it's something that I hope our listeners can hear and get excited about, like just being able to create your own path and like just appreciate medicine, I guess, from the other side, right? Like just, seeing, the physicians interacting with residents, for example, as opposed to patients. Like, for example, yesterday we had a neurology panel and like the department had, really, really nice guy. He talks about how much like he loves his residents and he always has like sodas and candy bars and stuff for them in case they have a long night. And it's just like you kind of lose like you can lose sight of like the teamwork and the camaraderie if you just focus on like the long nights and stuff like that. But in any case, it's been cool to just slowly dive into things. I think is the way I would put it. Um,
Yeah.
and obviously over time you kind of you cast a wider net, or I guess that's not the best analogy. Like you dig deeper roots. Um, but yeah, haven't gotten to that point yet. Cross that bridge when we get there. But
Yeah. I mean, it's interesting. You talk about like being able to choose your own path, and I wholeheartedly agree with you. I think a lot of that is kind of self-directed.
yep,
And there's a decent amount of room, depending on where you go, but there's almost always some room in your fourth year and in those last few months of medical school to kind of tailor your rotations,
yeah,
different things that you want to be doing. And so to kind of jump back into like what you are doing in years 3 and 4. And I wanted to bring this up too, because you've been talking about like these people who know exactly what they want to do. And maybe, some of them will probably end up doing those things, but you really start to make decisions and understand yourself and your priorities and your preferences during your third year.
yeah,
I think most schools is when you start your rotations. And a lot of schools now have kind of 18 months of didactic, and then they
yeah,
start rotations in year kind of 2.5. And some schools have 1 year of didactics and start in year 2 with their rotations. But you hear talk of rotations or clerkships, which refer to kind of the time you spend in the clinical space. And so
yeah,
most schools have kind of set in stone rotations that everyone has to do. And so everyone has to do, at least a couple of months of internal medicine. And usually part of that is kind of in the hospital, on the wards, taking care of hospitalized patients. And part of that sometimes will be in an outpatient setting as well. Sometimes part of that is specialty care, like a month of cardiology or a month of gastrointestinal medicine and things like that. everyone does a couple of months of surgery. Maybe it's general surgery, maybe it's specialty surgery, things like that. For me, I did 3 months of medicine and then 3 months of surgery. Everyone will do, some time in obstetrics and gynecology. Everyone will do some time in pediatrics. Most places, I think everyone does time in psychiatry. Most places do time in neurology. We did time in family medicine as well. And these are, variable lengths. Like for me, it was 3 months of medicine, 3 months of surgery, 6 weeks of obstetrics, 6 weeks of pediatrics, like a month of psychiatry, a month of family medicine, a month of neurology. But again, there's some variability there, but the idea being similar that like there are kind of these foundational concepts in medicine, foundational clinical skills that you need.
Yeah.
And you need to have these experiences. It's part of standardized medical education. And so we all kind of do those rotations and learn from those experiences that we have. So one of the interesting things about kind of how the clerkships work as well is that you have certain expectations. There are kind of two parallel tracks of learning that are occurring during these clerkships. And the one is kind of like, what do I need to know to be a competent clinician? Like if you're on labor and delivery on your obstetrics rotation, like you need to understand, kind of how labor progresses, and you need to understand like oh man, I can't even remember like the fetal heart rate tracings, things you'll learn about, Ahmed. You need to
That's good.
understand kind of like what it looks like when you're coaching an individual through labor, and like how to, for lack of a better term, like catch a baby. I'm sure there's a better way to say that, but that's kind of the
Deliver.
vernacular. How to cut an umbilical cord, how to massage out a uterus so that a placenta is can be removed, things like that. Those are like clinical skills that you need to learn in order to be like a good doctor on your rotation.
Right.
Maybe you're not going to be an obstetrician. Obviously, like I've forgotten some of these things. But like when I was a student rotating in obstetrics, like I knew those things down pat because that's what you learn while you're there. Like you learn how to be a good clinician. At the same time, kind of on your own time, you're spending time studying for a shelf exam. And the shelf exams are these exams that you take kind of like any other like final exam, so to speak, at the end of a class. And so the 6 weeks of obstetrics is your class, so to speak.
Right.
Learning about, clinical skills and things and how to take care of patients while you're there. But when you get home in the evening, you have to study for the shelf. You have to study for your exam. And so there's a whole, other set of information that you need to learn that's maybe a little bit more esoteric, that's not going to help you when you're in clinic the next day. But
Right.
they're also important things. And, I should qualify by saying there is a good amount of overlap between these two kind of bodies of information. But sometimes it is a little bit competing. On your surgery month, you might do a month of, colorectal surgery and a month of urology, but you're still going to need to know something about, there's a couple of questions about neurosurgery on the shelf. And so like, you need to know those things, right?
Yeah.
You need to learn this body of information on your own time so that you are prepared for the test. And so that's why, you mentioned that some people were saying that, like the first year of medical school is the hardest. And, I guess everyone's experience is different, but my argument for the clerkship year of medical school being the hardest is this idea, like you're learning two different sets of information. You're spending all this time in the clinic, like learning to be a doctor and trying to figure out how to take care of patients. And then you're spending a good amount of time on your own as well, studying for these exams that you have to
Right.
pass in order to complete medical school. And so it's no small feat. I think it's hard. It's taxing. Some rotations are less demanding than others. I think my experience was that the first year or first 2 years of school prepared me well for psychiatry, because a lot of the psychiatry shelf exam is pharmacology, and we talked about
Okay.
pharmacology and the different drugs that are used and how, what their mechanisms are and how they work and things like that and what to use them for. And so you already have, a decent amount of background for something like that. And so you're not, slaving to learn those things in your free time. Whereas something like I mean, I'm talking about obstetrics. For me, obstetrics, like it was not something I was super familiar with.
Yep.
Actually, I did obstetrics I did obstetrics in like October, November, and then we had our first baby in March of that next year.
Yeah.
And it was great to like have some context for what was going on when we were having a baby. But sometimes I think like conversely, if we'd had the baby first and then I had done obstetrics, like would I have just been a superstar? You know, probably not.
Well,
But
hey, who knows? Like, if you were that superstar, maybe you would have gone into obstetrics. Who knows?
I liked obstetrics, you know, and that's part of what you'll like. That's part of the beauty of this year, right? Is that you don't necessarily get to choose what you're doing. Sometimes you might have some say if, you know, and I mentioned, you know, for us, we had an outpatient medicine clinic that we spent time in, and we could submit preferences of like, oh, I'd really like to do, you know, a month of cardiology clinic or a month of general medicine clinic and things like that. And so there was a
Right.
little bit of preferencing, but by and large, like you're doing what you're assigned to do. And so you have to have exposure to all these different fields. And that really helps you in understanding what you like, what you don't like, ruling things in, ruling things out, you know, understanding what's important to you. You know, like, do you love everything? And so you're just solving for, you know, what has the least terrible hours? Or do you like hate everything except for really high risk surgery? And you learn that on these rotations. You know,
Yeah.
it's it's easy to like look at it from the outside and say, like, well, you know, the heart's really cool. And I think opening someone's chest would be amazing and like very impactful. And so that's what I want to do.
Yeah.
But then you get in there and you do heart surgery for a week, and it's just a different experience. I don't know if I can really
Yeah.
explain it appropriately, but like you know, you can imagine like doing it is a different experience than, you know, intellectually understanding it
Right.
and thinking about it. And so that's where those rotations are so important. And really like another kind of major difference from undergraduate from your undergraduate studies is that this is a mandatory part of your training, and it's a kind of a beautiful time and a really helpful time in making some of those decisions and in kind of honing where you want to go. And similarly, you know, when you finish those rotations, then hopefully you have time to do some rotations that are kind of your choice.
Yeah.
And that can help you further, you know, if you're kind of down to two or three things, then you can spend an extra month doing one of those things, an extra month doing another one of those things, and realize that one is for you and one is not for you. Or you can do, you know,
Yeah.
if you've figured it out, you can do away rotations and spend time making connections and getting to know people at other programs and other facilities that could help you, you know, in your process of applying to residency and trying to match.
Right.
And you know, we had some opportunities to do. We had a guy who spent some time abroad doing service work, and you know, we had some virtual classes that people took and would go and see family while they did virtual work. Um, but I think there is, you know, some flexibility there on the back end to say, I want to spend even more dedicated time learning about X because that's what's important to me. And so I kind of to bring it full circle, you know, of what you have been talking about in this first year, you know, you have this flexibility and you can spend some time. And I think you lose some of that flexibility during your clerkship year
Yeah.
because you're so directed towards your clinical responsibilities and, you know, learning so that you can do well on the shelf. But then you gain it back and more kind of in those last few months or last year, depending on kind of what things look like, in that you have, you know, all the flexibility in the world to tailor things and create the experience that you want moving forward into residency.
100%. I think, for anyone listening, like, I hope, that this idea of, starting a new chapter and, getting to actually now contribute to the, well-being of others gets you excited. I know it certainly helps me sort of get motivated when, I'm, studying late or, I'm just having a busy day. I think it's just always a helpful sort of motivator to reflect on, okay, like this is, what I've been working so long to get towards. And hopefully, you get excited hearing about, Eric's experiences and my brief experiences, and, getting ready and prepared to carve out your own. Real quick to wrap up here, Eric, highlight of medical school. What was your favorite memory, favorite experience, whether it was, part of the curriculum or not?
I don't know if I have like one favorite experience. I think I have some kind of impactful experience. I think those would be not that they were like the most joyous per se, but like some formative experiences of treating patients. I think the most impactful and the most important things that you'll do are when you're a medical student and you're given responsibility to take care of someone. You don't sign orders as a medical student, and you can write notes as practice notes sometimes, and the residents will often use them in kind of creating their own notes. But you're not like doing all the legwork.
Right.
But you'll have patients that you kind of follow and that are like your patients, and so you're taking care of them and you're thinking about their plan. And those patients were the patients that kind of left an impression on me. Like I remember. I remember we had a session, one of our kind of small group sessions. They would still kind of intermittently go on while we were in our clerkships. And we had one that was about breaking bad news and kind of like what are steps of breaking bad news and what does it look like and
Yeah.
how do you do it? I think it's like,
Did
you
you
like
guys
ask them what their understanding is of what's going on, and then you
did you
kind
have the mnemonic, like the spikes protocol?
of that definitely rings a bell. Uh, Anyway, I don't remember exactly what the steps were that they taught us, but we had recently talked about this at that time, and I had this patient who had come in for a heart failure exacerbation. And so he was like fluid overloaded, and we were diuresing him and getting fluid off and trying to get his heart working better again. And he had a history of prostate cancer, and at the time he was admitted, he had been scheduled by his oncologist. He was in remission at the time. He had been scheduled by his oncologist for a PSA screening, which is a screening test that it's kind of controversial in healthy people, but in people who have had prostate cancer, it's often used as a screening test of if your PSA, it's a hormone or an antigen that the prostate produces, and so if it starts to creep up, then it's suggestive that a cancer has returned, or that there's proliferation of prostate tissue
Right.
effectively. And so we had this patient who was supposed to get this test, and he was admitted, and so he couldn't get it. And we talked to the oncologist, and she said, "Yeah, just do it while he's inpatient. It's fine." And we got the test, and it was elevated. So the implication was, like it's likely that your cancer is coming back. And we had talked with the oncologist, and she was like, "Yeah, you guys just go ahead and let him know." And my attending was like, "Okay, Eric, well," and I was, we did our clerkships as second year medical students. And so I was in, the latter half of my second year, still pretty fresh, and he was like, "Okay, Eric, well, like, do you know how to break bad news?" And I was like, "I mean, yeah, in theory." He was like, "Why don't you tell this patient about his PSA being elevated?" And I was like, "Yeah, this is like a real thing, this is like a real conversation that we're going to have. And like, it matters to this guy." And like it went fine. It wasn't anything remarkable. And he took it really well. I think he had probably been prepared by his oncologist that was, a possibility.
Mhm.
But I just remember, it was kind of a heavy moment for me. It was like the way that and I think we talk a lot more in kind of modern medical school about the art of medicine, kind of like interaction with patients and how to appropriately interact and how to make people feel comfortable and how to ensure understanding and, so on and so forth. And so it felt like, this is an opportunity for me to have a conversation with a patient that matters and to make it obviously it's bad news, but like make it as good an interaction as possible,
Right.
like make sure he feels heard and cared for and that he understands what's going on. And, I think the practicing and the role playing and all that stuff that we had done to that point, like, was helpful. And it was just a good interaction. I came away feeling like, a lot of medical school is kind of observational learning, but that was one. And there, I have other stories like that, but that was one that sticks out as, a time where I like really put on the hat of like, I'm your medical provider, and like, we're doing something for you. And obviously, like, we didn't treat him at that time, and it was like a discussion with the oncologist down the line. But
Right.
But experiences like that, where you put on the hat of I'm the doctor and like let's talk about something, or let's do something for you. Let's like help you understand this disease, and let's, encourage you to follow through with treatment. Those are highlights. Again, not because they were happy moments per se, but because they were like, that's what you're doing this for, And when you finally get to do that, it means something. And
Yeah.
so,
I mean,
I would look forward to those moments.
that's awesome, man. Like just it sounds like the reality set in. Like, hey, like I'm doing this. This is
Yeah.
real. And kind of going back to my point earlier about like the motivating aspect of knowing that you're on your way to actually making an impact in somebody's life. I think your story just perfectly attests to that, Eric. And I'm sure 2 years from now when I start, or a year and 8 months from now when I start clerkship, there will be similar experiences. But even just briefly, in our clinical skills sessions, last week was our, we transitioned from standardized patients to real patients, and you just see the difference. And obviously we're nowhere near treating them, but like just having a real conversation with a real person is sometimes really uplifting for people in the hospital. And to see that you can make somebody smile without changing their physical health whatsoever
Mhm.
is a really humbling reminder of even like extrapolate that beyond medicine, just like how your little actions day to day can impact others. And you know let that be one of the takeaways today is like you never really know how you can impact somebody, and so it's always best to just be the best version of yourselves, just not just for yourself but for the people around you, because it reverberates. Like I'm sure you and I can both relate to like times where like we've walked into class, for example, and we're not having a great day, but we see some of our friends excited. It's like, all right, you know what, today's going to be a good day. And the hospital is the exact same way, right? Except oftentimes we're going to be that, that beacon of excitement or hope
Mhm.
for
Yeah.
for other
'Cause
people. And
everyone's having a bad day in the hospital. You got to,
yeah,
it's having a good day and helping people have a good day.
exactly. And if you hear that and you're excited to be that, that spark plug, then keep doing what you're doing, because you're going to make a good doctor, or at least that's one of the many factors to making a good doctor. It's just like being that source of inspiration and hope and excitement. And I know, speaking for myself personally, that's something I'm really looking forward to, and I'm sure that many of our listeners can empathize with that as well. Anything you want to add here, Eric, before
No, no, it's
we
a
wrap
beautiful
up?
sentiment. All right. And I would just echo to hold on to that, that excitement. It's a beautiful thing to be able to help people when they're sick. And you guys are on your way. So keep up your studying. And it's hard, and it's it's taxing, but you have to remember the kind of the end goal and what you're going to be able to contribute to society. That's really what we're trying to do, is contribute and help people and make their day better and make their life better. And those are, valuable things, and certainly worth the travail of taking the MCAT,
Yeah,
and all of the things that go along with that.
yeah, 100%. As Eric said, guys, keep up the studying and let that, end goal be a motivating factor for you as you progress through your studies. As always, if any of our listeners need anything, please don't hesitate to get a hold of your academic advisor here at Jack Weston and see how we can connect you with resources that may support you in your preparation for this exam. But as we said, keep up the excellent work and the hard work and the studying, and we'll see you guys next time on the next episode of the Jack Weston MCAT podcast. Take care, guys.